Hi, I'm Wendy DeMonte, Vice President of Advocacy and Community Partnerships at Renown Health. But you may remember me better from my days at KTVN Channel 2, where I had the privilege of being a part of your lives for more than 20 years as your evening newscaster and Health Watch reporter. So, you may be wondering, what am I doing now? Well, the Renown Health mission is to make a genuine difference in the health and well-being of the people and the communities we serve. We believe a healthy community requires the contributions of every person and organizations who live in this vibrant and diverse region. That's why we work together with our partners, like the Washoe County School District, on our mission, vision, and values. It is our goal that together we provide and support a better understanding of your overall healthcare benefits as well as your wellness programs. Your risk management team wanted to create a new way of communicating with you, so from time to time, I will be telling you in these video tutorials about your overall healthcare programs. We hope you find them easy to understand and informative.
And here we go for today's segment. We're going to talk about proposed changes for the 2017 plan year. Our objective for today is to review the information that was provided in a memo describing the recommendations to the Board of Trustees for the Washoe County School District upcoming 2017 Health Benefit Plan year. Okay, take a look. Our agenda will include define self-funded plan, what is the insurance trust fund, your health insurance committee, increase projected for 2017, recommendations to the Board of Trustees, and then next steps. Now keep in mind, it might be helpful to follow along with the memo that you received in your email. All right, let's get started with define self-funded plan. Here, take a look. Now the Washoe County School District is a self-funded insurance plan. Okay, so what does that mean? Well, I thought I would show you a short video of what it means to be self-funded. Later in the year, we will send you a more in-depth information packet about this type of plan.
What is self-insurance? It's just what it sounds like. Instead of purchasing an insurance policy, a company or other organization, such as a municipality, school district, or union, simply bears its healthcare costs directly. And to protect against a catastrophe and reduce their financial risk, they take out an insurance policy on the secondary insurance market called stop-loss coverage or reinsurance. Self-insurance allows companies to tailor their services for their employees, to not pay for what they don't want, don't need, and won't use. To get the best prices, self-insured companies use third-party or health plan administrators who negotiate volume purchasing and take care of billing and claims processing. So by self-insuring, companies are able to better manage their costs. Today, 61% of all employer-provided health care is through self-insured arrangements. Almost all large companies are self-insured, and many smaller companies are moving towards self-insurance.
Okay, the Washoe County School District plan is currently made up of covered employees and retirees. Now, active employees, there are 6,452 of you. Retirees, that totals up to 1,048. Total active retirees, 7,500. And total employees retirees with dependents, 2,466. Okay, now we're going to talk about what is the insurance trust fund? Well, as you learned in that video, the trust fund, made up of employee and retiree premium and budgetary money allocation, pays for the plan. So, here's what your insurance trust fund balance looks like today. Now, the beginning fund balance as of January 2015, it was $18,807,912. The ending fund balance of December of that year came to $5,490,462. So, that amounts to the fund balance as of January 30th of this year to right there, $11,521,381. On to your health insurance committee. As required by your plan, the insurance committee is a team of 10 individuals made up of 8 employee associations representatives, 1 management representative, and 1 retiree, and they all meet regularly. The Insurance Committee meets monthly in an open forum. Over many months, the Insurance Committee has met to discuss, analyze, and ultimately make recommendations for the employee and retiree health insurance rates and benefit plans to the Board of Trustees for the upcoming 2017 plan year. As you can see, this committee, boy, they have been pretty busy. Now we're going to talk about the projected increase for 2017. Take a look at that number, $8,250,000, which equals 11%. So here's what's going to be recommended to the Board of Trustees for 2017. As you can see, this is a breakdown to meet that 11%. Take a look at the pie chart. The premium increase is 7%, which totals just over $5 million. The benefit changes are at 4%, or just over $3 million. Now, the Insurance Committee provided options for a 4% change in some of the planned benefits. Let's review the recommendations. This is a pretty busy screen, but that's okay. I'll walk you through it. Take a look at the dark blue side on the left-hand side of your screen. Those are all the benefits for the PPO plan changes, as well as the EPO plan changes. The next column over is your current plan design. Next column is the recommended plan design change. Okay, so for instance, under the PPO plan change for a primary physician visit, currently you pay a copay of $25. Under the recommendation, you would pay $35 in copay. How about in the EPO plan changes? Let's say for an urgent care visit, currently the copay is $30. The recommendations would increase that to $50. Again, all totaling that 4% change, which is just over $3 million. In order to achieve the overall 11% increase to the fund, the Insurance Committee increased the medical premium by 7%. So let's review the details in the premium increase. Now keep in mind, the recommendation is for the active employee plan. The employee-only tier, there's no increase. The employee plus spouse tier, that equals a $24.64 a month increase. Employee and one child tier is $15.23. Employee and two children tier equals $29.76. And the employee and family will go up $38.90 per month. Okay, now let's take a look at the recommendations for the retiree plan. A 0% subsidy tier, that's a $42 increase. 40% subsidy tier is a $26.58 increase. 60% subsidy, you'll see $18.88 increase. And an 80% subsidy is $11.17 increase. And then the 100% subsidy is a $346 increase. Now, if you have a spouse on your plan, it's an additional $24.64. One child is a $15.23 increase, two children is $29.76, and a family is $38.93 more a month. Here are the premium changes for all employee plans and tiers, along with the retiree plans and tiers. Now, this information is also provided in your memo and can be reviewed in more detail. All right, take a look. Here is the active plan. We'll give you a minute. There's a lot of numbers on this screen, so take a peek. And here you are for the retiree plan. Again, you can take a closer look at this information in your packet. Okay, you're ready for the great news? The district will continue to pay employee insurance premium. And a few additional options are also being recommended. Add an additional plan option, high deductible health plan with health savings account, and pharmacy change from CVS Caremark to a new pharmacy benefit administrator on the plan. Okay, here are some next steps. Open enrollment begins September 19th of this year. And the next Board of Trustees meeting will be Tuesday, August 23rd at 2 p.m. at the Washoe County School District Administrative Building on East 9th Street. Do you still have questions? We have some answers for you. All you have to do is contact the Risk Management Department. You see the email on your screen. You can also give them a call at 348-0343. Again, we hope you found this tutorial easy to understand and informative. I'm Wendy DeMonte. Stay tuned for the next one.